Live.
Hey guys, it's Dr. Emer. We are in Manhattan today and we're filming with a bunch of people. It's exciting. We have a big group here today. And my patient today is a very common patient I have in the practice that comes in wanting overall textural improvements of the skin, pore reduction, pigment reduction. They just want to glow. They want their skin to look soft. They want it to look nice. Here we're doing a treatment called Nano-Fractional Radiofrequency. Let me show you what this is. When you look at the tip here, these are not needles, these are pins. And what that means is I can touch this, it doesn't puncture my skin. So not like microneedling radiofrequency or microneedling that causes bleeding, this just touches the surface of the skin and distributes the energy through the skin through little pins. So if you look, if we go zoom in, come real close, let me show you guys here. Come real close, look right in there. Saw the little dots? All those little baby dots? Those are the pins delivering the energy into the skin. And we can do two ways. We can pinch and try and get a little deeper, or we can press really, really hard on the skin. And what this allows us to do is to address numerous issues that she has with her skin, mainly of the complexion and pores. My patients really love this treatment, but it's something you do in a series. When we did the original studies of this, we were just doing it for testing out safety, but then what we found out was the patient's texture, color, and scarring improved. A lot of scarring improved with this treatment, which is why soon afterwards microneedling radiofrequency came out, which was deep microneedling. So this is going to address the surface, and it gets a little more sensitive here because you're right by a nerve. Are you okay?
Yep.
Okay, you're wonderful. Describe how it feels to people?
It feels like little pinpricks and it's a little warm. It's
Okay.
definitely not too bad.
So it's
definitely
more
bearable.
tolerable,
Very
but
tolerable.
not terrible.
Right.
Okay.
I can feel it, but it's definitely tolerable.
Well, that's reasonable because I don't want you to go writing an online review saying Dr. Emer tortured me,
No.
right? That's the key. We want you
Definitely
coming
not.
back for treatment. But I want to tell you guys the reason these things were developed, especially these nano-fractional technologies, meaning very low amounts of energy delivered to the skin, was for sensitive skin types, mainly those with ethnic background, pigmentation, darker skin types, because they wanted to make sure that they could also do laser treatments or energy-based treatments. These are radiofrequency, which is very safe on dark skin type. Turn all the way left. I'll show you guys something really cool in a second. And so this is a very popular treatment right now in Korea and in Asia, all parts of Asia, because Asian skin type is very sensitive and you can use this treatment with other things like IPL and Aerolase and Clear and Brilliant and microneedling PRP to get even more outcome. Now we're doing a really strong treatment on her, and I'm very impressed. I'm super happy because I really would like for her to, take pictures every day, show us how she's doing. Any questions on social? You can come closer, Justin, if you can.
I don't want to get in the camera angle.
Got it. I want to show this in 1 second on social. What's important to know about radiofrequency, and when we did the clinical studies on this, was we didn't know the degree of subdermal heating. So we would send patients home without any cooling or anything. And then they would call us about 3 to 4 hours later and say their face blew up like a balloon and they felt like they had a terrible sunburn. So now we learned our lesson. We always do cooling masks or cooling for 5 to 10 minutes afterwards. You have to do that. I'm going to show you why. Take a close look, okay? You zoom in here. You see all this elevation here, this yellowish discoloration in the skin? That's urticaria. That's called hive. That's deep tissue swelling. That means you did a great job. Your skin worked, okay? You went to the skin gym and it worked. So now we've done the workout. We're going to have to cool it down, which we'll do with our cooling in a minute. And then basically you're going to go home and start doing your skincare regimens. Now we know with that you're going to get a very good improvement because all that energy is delivered deep under the skin and it's going to produce collagen. So I'm being very thorough here. covering every spot, and then I'm going to show you a split face. You can even treat the nose pores. But this is really nice, not only on the face, but great for the chest, great for the hands. We go this a little more sensitive as we go under your eye, okay? But this will help tighten the wrinkles there. Any early signs of aging.
Yeah.
I know, we're getting them, we're getting them. Don't worry, I'm your partner in crime here.
Mm-hmm.
I'm gonna do it on the other half. Just want to get the half face done, and I will put it on. So now if you guys take a look, we've done half the face. Take a look at one side with the other. We're all done. Treatment's over. I'm kidding. So
Just
you can
half.
see, I know, only half. So you can see the nice designated line. You can see all the little dots, the nice soft tissue swelling. That's how it should look right now. This is perfect, a nice homogeneous pink. And then we start the other side. What will happen is these little dots, and now I'm gonna go to the other side, will start to exfoliate over the next few days and sort of release the old skin and bring out some new skin and develop new collagen. And that's it. Any questions?
Mm-hmm.
Downtime can be customized to a few days, to a few hours, even to a few days. You can combine certain peels with this, like lightning peels, PRP treatments to boost collagen production and help brightening. Facials at the same time can be done right before. And turn all the way to the right for me. There you go. And we can do, even for these scars, you can do independent scar treatments with a stronger laser or fillers if needed. But the key to this device is to be very, very thorough over the treatment area. Okay. Well, I think that's good. Any other major questions you guys want answered? No? All right, we're going to continue treatment and we'll do a testimonial afterwards. Bye, guys.